Hi everyone, Matt here. I got a question for you. Do you think personal trainers can know as much as physical therapists? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video on another topic of something from the physical therapy world. In this one, I was scrolling the TikTok the other day, and I came upon a video of someone stitched of another video. And it's something that I have just seen over the years. And before we get into it, if you have not subscribed, go ahead and hit that subscribe button. It helps out so much. And if you enjoy the video, hit the like. But this is something like, like I just had to go to it. I'm just going to play it right here.
So you want to become a physical therapist? I'm gonna give you the cold hard truth. I know more than the majority of physical therapists.
No, you don't. So that video is just this thing that it just seems like it's just been this rivalry for so long. I was a personal trainer over 20 years ago. When I got out of college, I did the personal training thing because I wanted to like exercise and move. Like I liked doing that. I liked how the body responded when you did things and it get stronger or faster or jump. I enjoyed those things. And I remember trainers that I was around that they would put down physical therapists. They would put them down. Oh, they don't know about anything. They can't do this stuff. They can't do that. And it was so funny to hear these trainers at the time being like, we get people in here and we kick their behind. We push them so hard and they change their life. And they, we have them do, hard resistance training and we make them do the cardio and we get those results. And all those PTs, they just have them do these little light weights and all these like corrective things and stuff. And that's just not enough. But I'll tell you, it's funny. It's seemed to have flipped now that there are many physical therapists that will say, like, no, we have to push you. You have to work hard. You have to lift heavier weights and do heavier resistances and get your cardio in and do these hard things. But then there'll be trainers like, no. We need to do 3 months of these corrective exercises, these low dose, low intensity exercises to correct everything. You have to earn the right to touch a barbell, and who knows when you're going to get that. No. You can't do these things. You have to do these little, lightweight PVC pipe activities months on end before you can actually start doing stuff. It's just funny how it's just seemed to have flipped here. Maybe I'm biased. I don't know. But in that comment, I would say there's some issues with it because it's so broad and so general. I mean, really look at it. Because, I know more than most physical therapists. Okay. What exactly? And it is so broad that if somebody that supports them could easily just put whatever in. That's how it is. It's kind of like it's a blank canvas and somebody can just put in whatever that they want to agree with it. So we want to talk about things like speed training. Okay. Oh, I can get athletes faster, people faster with sprinting. I know more about doing that with people than most physical therapists. Okay. There's over 600,000 physical therapists in the US. Not all of them work in orthopedics. Okay. So you got a good number that work in things like pediatrics, neurology, pelvic floor is a specialty, like TMJ. That's a specialty. Vestibular. Okay. Do they know a lot about getting people faster in a sprint? No, because that's not what they do. That's not what they go to work to do. And I would say it's not beneficial to spend a ton of time focusing like education in that area because it's not going to translate over into what you do quite enough. Okay. If you want to argue about that, go talk to some of those people and see how much it actually does. So it was easy to say, well, I know more than them. Okay, because that's not what they do. But flip that around the same way. The PT that treats people with BPPV can easily say, well, I know more than all personal trainers on treating BPPV. Because, it's very easy. It's just, again, just so broad and people can just kind of put these things in there to just agree with it, just so they can just set it up where they just agree with that statement. And like I said, it just seems like there's just been this rivalry for so long. And I don't understand quite what it is. And maybe it's the fact, like, again, and I'm not putting down personal trainers. I'm going to get to that here in a little bit. But oftentimes to be a trainer, I mean, you can just take online certifications. That's what I just remember that years ago, again, when I was with, that people would talk about, like, oh yeah, there's this one, it's $50 and you just take a quiz and boom, you got it. But if you go get these, there's a lot of training and education that goes into it. So these are better. So you want to get people that are better. So again, and there's also some that go to, through college and they get exercise physiology degrees and they do that and they work with people and they all that. But I will say, it just seems like people that do training at times think like, oh, for most people, just dealing with pain or an injury, it's just exercising. It's just getting people exercising. And I will say that can be true to a point. There's people that have very general pain in an area. I've seen that, kind of a general back pain. I would say, like, yeah, just starting to exercise and move, you're probably going to start to feel better. That's what you need. You just need to exercise and move. You will start to probably most likely feel better. If you work on those things, start getting some sleep, start getting a little cardio in during the day, just going on walks, just do whatever that you start fixing those things, you're going to feel better. With some injuries, okay, pull your hamstring. What do? Okay, you just drop the intensity of stuff down and you just build yourself back up. That's what you do. They think like, oh, well, it's just everybody's like that. People are just that's all you do. It's just all exercise. But here's the thing: there's a lot of nuance into stuff. Okay, how would you, again, with this person? How would you work with somebody who has a cervical lumbar or a lumbar radiculopathy with a weakness going on? How are you going to work? When it hurts to bend and it hurts to extend, do you know how to treat that? Do you know how to work with them on that? I've had people, again, they try to go in to do all this stuff and it hurts them. There's one specific spot on people's low back. I get this so much with my lifters. They get this spot that will hurt them with squats and lifting. They do all this stuff and they can't fix it. And they'll go to this person. And I had one case where I just had a consult with this person. They didn't believe me on what I told them. And they're like, no, it's my SI joint and I need to do this and I need to do that. They never got better. It's been over 2 years. Never got better. Because they were just listening to like trainers and just telling them on stretches and things like that. And again, I've seen, and speaking of that, that's what I've seen when trainers get into like wanting to try to like rehab stuff. They get into those things. They'll go take courses on like corrective exercises. Oh, here's some soft tissue stuff. I'm just going to learn how to do that stuff. And I'll just add that in. I can just massage you and just stretch you and I do that. Well, I got this device that I can put on you that can help. Is that really going to help people get better? Now, I'm not bashing trainers the whole time. And I will say, as physical therapists, we should have knowledge of how to load up people, how to program exercise, how to progress people and do things like that. But we're also in two different worlds, okay? Not everybody that comes in can be doing all these crazy things, okay? So there is nuance so much to what we do. But I'm going to say this. I will say this right here. I think a very powerful team is when you get trainers and PTs together, working together. It is something that is absolutely amazing. Okay. And I would say any trainer, you should know PTs all around you. And PTs, you should know trainers all around you because you can help each other so much. So like a trainer, okay, maybe your client's dealing with a pain. Maybe they get injured outside of the gym or somewhere. Okay, what do you need to do? Okay, I want them to be able to keep training because if they have the injury and they stop training with you, I'm going to tell you, they're most likely not going to come back. Okay, as soon as people stop something, there's a good chance that they don't come back. But it's like, hey, I know this PT over here. The knee is their thing to do. Let me send you over. Let me send you over there. Let me call them. Let me see if they can get you in. And then the PT, hey, cool, thank you. I'm gonna take care of them. You can set up an agreement that you can conversate back with the trainer. You'll get the patient's permission. Okay, this is what they got going on. I want them to do this with the progression. Let's have a conversation. And you're both working with this person to help them get back to doing that. And that's a great benefit for the trainer to say, hey, if you deal with any injuries, you have this stuff, I can send you to someone that can take care of you. It's a great selling point. In PTs, it's like I said, great to have those trainers around you because we can hit a point with patients when, goofy stuff with insurance, you got to work on function, and they hit a point where it's like, okay, well, you can't keep coming in, insurance limitations, or maybe they just hit a point where they get discharged, they hit their goals, and they can be discharged. Hey, let me get you over to this trainer, and I know this trainer. I think y'all are going to work great together. Because again, if you know many in the area, you can find the personalities or whatever the niche or whatnot. Send them over there to them. Hey, cool. They're going to help you. They're going to keep you going because you've started exercising. You're going to keep on going, and it's a great thing because you can just feed them these clients with them. It's just a great, amazing thing that is when they partner up, and I do enjoy it so much. I do enjoy it so much when I get to work with trainers and coaches and things like that. Now, I've seen this thing, and I think that trainers want to be PTs and PTs want to kind of be trainers. There's this thing where they kind of want to blend it because I've seen this thing, like I said, with chiros and PTs that are like, oh, if I had known what I know now, I would have never went to PT or chiropractic school. I would have just got a personal training certification, and that's what I would have done. I'm going to say it's very hard to say that because PT, chiropractic school, that stuff sets a foundation, okay? That sets a legitimate foundation in your understanding of things like anatomy, physiology, biomechanics. You learn how to talk with people. You learn how to understand and recognize things. You gain a whole lot of knowledge of just how things go. Like I said, from conversating to understanding the body and how the body responds from that schooling in that time that you spent as a PT or a chiropractor, okay? I will say that you can understand. Because again, on the flip side of the personal training, where would you have gotten that? Honestly, like, okay, yeah, you can maybe say you got it through your undergrad with like an exercise degree or something like that. But can you say it would be even remotely the same? And any time I see people that say like, oh, I would go back in time and change. No. If you could go back in time, it wouldn't be to change that. It would have been to play the lottery numbers that hit that multi-million-dollar lottery. Okay, so just stop it. You would not have done that. Okay. I'm just gonna say that right here. Okay. But anyway. I just think this was just a goofy take. They just wanting to be overall. Again, I think dudes just want to be controversial. Let me just say something really controversial. So people get in here and they start commenting and do whatever. I'm not going to engage with the people, whatever. And the people that like me, they're just going to fight back in the comments. And that's the thing. And I would tell anybody, if you want to go into physical therapy, you can do a lot with it. Okay? You can do so much with it. You can actually be someone that, again, works with people, rehabs them, trains them, does those things. And I will tell you, people often, when it comes to their health, they often like people that have medical backgrounds and understanding. And I can tell you how many times people are like, yeah, I would feel more comfortable going with somebody that has that professional background, that medical background, because maybe they have high blood pressure, cholesterol, diabetes, or, some other comorbidity going on that's serious. And they want someone that can monitor them and just kind of keep that in mind a little bit more. And I'll tell you, like, as a PT, that kind of gives you that on there. And also, likewise, I'll say as PT, you can always find a job. I'll tell you that as well. When I was a personal trainer, oh my gosh, that was the most cutthroat thing. Trainers they're trying to steal your clients all the time. The people you work with, they're trying to badmouth you and take your clients. Oh, they're trying to pull here. It was just all over the place. Anyway, and like I said, I think it's a powerful duo to have a PT and a trainer together. It's an amazing thing. Anyway, let me know your thoughts, beliefs, and opinions, all that down in the comments below. I like reading those and just want to hear that and have a discussion and dialogue. If you enjoyed the video, hit that thumbs up button. And of course, subscribe to the channel. It doesn't cost you a copay or anything. And until next time, take care of yourself. Take care of your patients. I'll see you then.